So if you're a pet owner and you're thinking about having your dog's mast cell tumor treated with Stelfonta, or if you're a veterinary professional, it's so important to see some of these cases and see how the response is. And that's what I want to tell you about. Welcome back to the vlog. I'm Dr. Sue Cancer Vet. And in this little series, I want to tell you about some of the first cases that I treated with Stelfonta in the US. So let's start with Tucker. He's actually the first case that I treated in the United States. You may know that I was fortunate enough to treat 4 cases when I was over in Australia in November of 2019. But Tucker's mom, believe it or not, she gets the award for quite the long distance commute to come and see me. She lives in LA and I work in Connecticut. She knew that I was going to be one of the first veterinarians to have Stelfonta and that I had experience with Stelfonta administration. So we had spoken in December. Tucker's mast cell tumor that she wanted treated was on the elbow, and it was a pretty large tumor. It had been there since June of 2020. Tucker is an 8-year-old male castrated pit bull. This mast cell tumor had been previously treated with electrochemotherapy. Why didn't we just try to remove it surgically? Tucker does have heart disease. He is managed by a cardiologist. He has 2nd-degree AV block and a heart murmur, and does have anesthesia and sedation concerns. So those are lots of reasons why you might consider Stelfonta for a patient, for your pet. He had a large mast cell tumors, and it would be unlikely that we would get clean and wide margins. With surgery, that mast cell tumor would likely grow back. So, we did all of the things that we need to do to make sure that he's a good candidate for Stelfonta. We determined that it was non-metastatic, so he had all of his staging tests, ultrasound, lymph node aspirates before they drove cross country. You want to make sure, that he's a good candidate for treatment. And also there's a size limitation, so it needs to be less than 10 cubic centimeters. Hey everyone, this is our first Stelfonta patient. This is Tucker. He's a little bit fearful. But he traveled all the way from California to see us, and so before we give Stelfonta, we get measurements, length times width times height. We've already done that, but I'm just going to kind of show you. So you're going to do length times width. Good boy. So we did that like this. I've already wrote them down. And then height, we do a 3rd dimension like that. And then we're going to take those measurements, I've already wrote them down, and then we're going to put them into the dose calculation, which is length times width times height times a half. And then that's going to give us the tumor volume, and then we're going to give half that amount of the Tiganol, Tiglate, or the Stelfonta, and all of that can be calculated on the Verbeck page. So I'll show you that next as well. So his tumor volume on the day of treatment was 7.2 cubic centimeters, so definitely less than 10 cubic centimeters. So it's a pretty big tumor, and it's going to have swelling. So as I talk about in vlog number 130, Stelfonta causes oncolysis. It causes lysis of the onco, which means cancer, so of the cancer cells. So it's going to rupture these mast cells and cause degranulation, release of histamine and heparin and all of the little inflammatory mediators that are inside of the mast cells. So that's why it's so important that the dogs are on their steroids for starting at least 2 days before treatment, and their H1 and their H2 blockers. But what was so great about Stephanie, about Tucker's owners, is she sent me pictures and emails each day as we were going through. And so we have really documented his response to Stelfonta, and we're going to be able to share those pictures. And on the first day, you're going to see the tumor blacken and you're going to see the swelling. Dogs that have larger tumors, and especially limb tumors, even, tumors on the legs that are small, they're going to have, can have significant swelling and lameness and limping. And so it's important that they get a pain medication like gabapentin, so your veterinarian's going to send home with that. A couple of tips: if you're a pet owner and you're scheduling Stelfonta treatment, I usually recommend that they get treated on a Monday or Tuesday. Why is that? That's so when they're having all this inflammation and reaction, your veterinarian and their team are available to answer questions. Most dogs will develop that wound, if you remember from vlog number 130, day 3 to day 7. The dogs usually get much more comfortable after that, as there's more draining through the wound. So again, I usually like to treat them on a Monday or Tuesday. We recheck them on day 7. Look at Tucker's wound. It's beautiful. A lot of questions I got on Instagram and other social media sites is, why aren't you closing that up? Why aren't you going to suture that? It is going to heal on its own. As we talk about in vlog 130, where I go in much more detail, 58% will be healed by day 28, week 4, and about 78% will be healed by week 6. I'll be honest, I told Stephanie, Tucker's mom, I don't think he's going to be one of those dogs that heals by week 4. He had a pretty big wound. On day 7, his wound was 3 by 6 centimeters, was pretty big. Do you see we're looking at the skeletal muscle underneath? You need to know that this is what you're going to see with dogs that are on Stelfonta. We don't cover them. We don't bandage them. They do best when they're open. It's going to scar up. They develop granulation tissue and it's going to heal up over those first 4 weeks. Again, some dogs by 6 weeks. We don't want you scrubbing it. We don't want you washing it. They typically don't need antibiotics. They typically don't need e-collars and things like that. So what I was surprised is, look at the pictures when Tucker came in on day 26. His wound had shrunk down to 1.3 centimeters. And when he came in on week 5 was nice, just a nice scab and healed up. Poor Tucker, when he came in on week 5, mom had noticed a little bump on his medial thigh, on his inner left thigh. Why wait, aspirate? Of course I did an aspirate, and he had a new mast cell tumor. Came back a couple days later, started him on his medications, and we did treat that new mast cell tumor. So I will keep you updated on Tucker's progress. Mom is so pleased, and I think that's one of the things that has struck me most about the pet parents that I've met along the way, both in Australia and the cases that I've treated so far in the US, is how happy the pet owners are with the process. You know, this was a tumor that had been sitting there for about 8 months, had failed other therapies, and his came off around day 5.5. We show you the picture. It was kind of hanging off. She went in the shower, she came out, and it was gone. It was gone. And, you know, she really thinks this is such a fabulous treatment. So pretty exciting, very exciting treatment option. As I go through in vlog 130, you know, talk to your veterinary professional, find out if this is a good option for your dog, and I'm going to share more cases with you. I look forward to seeing you at the next vlog, and thanks so much.